Good morning. We'll call the Wednesday, September 11th meeting of the Criminal Justice Meeting to order. Start with roll call.
Mr. Hess?
Present.
Mr. Long?
Present.
Mr. Carrico?
Present.
Mr. Eckhoff? Mr. Hunter?
Via Zoom.
Ms.
Present.
Turner? Ms. Monday? Ms. Andrade? Ms. Armour Herbst? Mr. Ripmanick-Emy? Mr. Marion? Mr. Lowy?
Present.
Mr. Wheeler? Mr. Alexander Hildebrand?
Present.
We have a quorum.
Okay, I need a motion to allow Mr. Hunter in on Zoom. Mr. Long, Mr. Lowy. All in favor say aye.
Aye.
Opposed, same sign.
Thank
Motion
you.
carries.
Thank you.
Before we start the meeting, I'd like to ask for a moment of silence for those who passed away 23 years ago today at the World Trade Centers. Thank you. I have not received anything from public comment. Is there any public comment at this time? Any public comment? Move on to the approval of minutes from August 14th, 2024. Take a motion to approve. Mr. Carrico, second by Mr. Lowy. All in favor say aye.
Aye.
Opposed,
Aye.
same sign. Motion carries. Up next, Chief Judge, Mr. Cunnington. Good morning, sir.
Good morning. What's the other guy look like?
He's fine.
He's fine. Okay.
He had a big knife. No, that's bad.
I have a very brief report. Just to let you know, the judges are currently in training on the new Tyler system. It is going very well. I'm really pleasantly surprised that change is always difficult, but the trainers that are there from Tyler are excellent, and all the judges are jumping on board, even the ones that are not really technically very savvy with the computers, but they're jumping on board, and it's doing everything that we wanted it to do so far. We're still in the testing stage. We go live on the 23rd, so that's going very well. And then we're also making arrangements for the open house at the courthouse. I don't have a date yet. We're looking at the first 2 weeks in November, probably a 5 to 7 after hours type of thing. So we'll let you all know when that's going to occur. Trying to get everybody on board for that. We didn't have a Chief Judges meeting in Chicago in August, so I don't have anything to report from there. August and November, for some reason, those are the 2 months of the year that we don't meet. So we'll have a meeting next week. So that's all I have.
Any questions for the judge?
Okay.
Thank you.
Thank you.
Up next, Circuit Clerk's Office, Ms. Cianci. In your package, you have a copy of Sandy's monthly report. Take a motion to approve that by Mr. Lowy, second by Ms. Ripmanick-Emy.
Good morning.
I'll go ahead.
Go ahead.
morning.
I'll finish your
No.
motions. That's okay.
Comments on your report.
Okay. Well, I don't have any comments unless anyone has any questions. I mean, collections are low. There's nothing much more about that.
Any questions for Sandy on the report? We have a motion, a second. All in favor say aye.
Aye.
Opposed, same sign. Motion carries. What else do you have?
Well, so the conversion, like Judge said, is going well. Training has been fast and furious. Next week, I got my weeks all mixed up these last couple, this month. It's been crazy. But the auditor, the outside auditor, is coming on either Wednesday or Thursday of next week so that we can close out, probably Thursday. We're going to close out, do the final reports for all the financials, and then they're going to do the audit that we normally do in January. We're going to do the court view version from November until our last date here in September, and then she'll do the rest of the audit with the Tyler reports from that date through November 30th next year when we're ready to do the regular audit. just to make sure that we reconcile and balance and everything is good to go with all the financials. The 17th, next week, Tuesday the 17th, we have to, at the end of business, we're going to stop taking credit card payments because it takes a couple days for those to get deposited into our accounts, and we want to make it a clean cutover with the reconciliation. So we're going to put out an announcement today. I'm getting that finalized with, you know, with the credit card people and stuff to make sure what we're doing. So like with e-filing, we're not going to be able to accept e-filing if it has money related to it, because they usually pay with credit card. If they do an e-check, I think we'll be able to take that. So they'll have to come in and pay if they want to do that. So we're working out those final details right now. Our business with electronic filing and everything will stop on the 19th so that the conversion can start after business hours. And then on the 20th, which is Friday, everybody in court has to do everything on paper. We can't enter anything anymore into court view. We're done with court view at the end of business on the 19th. So then the cutover is going to start to happen on the 20th. It'll be done by the 21st. That Saturday, we're going to go in and start testing the different areas to make sure that everything came over properly and whatever. And then once it did, probably that'll be like between 8 or 9 o'clock in the morning and noon. And then after that's all confirmed, then we're going to go in and start putting in the work from Friday that we couldn't do, you know, at all. We're keeping court view as a view only for a while so that we can make, you know, if you can't find something quickly in the history in the new system, at least you'll have the old system that you know how to do to conduct your daily business. And then eventually it'll all, you know, everyone will be able to move forward with enterprise justice. So we just have a lot going on in the next couple weeks here. It's just all, we're ready to pull the Band-Aid off and get it going.
Any questions? Everybody understands this whole system now, right?
Yeah, sure. It's a lot, but it's going to be good. We're looking forward to it.
No questions? Thank
Okay,
you.
thank you.
Up next, State's Attorney's Office. Mr. Coughlin. In the package, you have a copy of the grand jury report and the grand jury statistics report. Take a motion to combine and approve them. Ms. Monday, second by Mr. Lowry. Good morning.
Morning, Mr. Chairman.
Comments on that on your report, sir?
I don't have anything on the report itself. I did hand out to everybody our invitations and sponsor letters for the Drug Free and fundraiser, which is going to be October 25th. This is our big fundraiser for drug court, and also this year we initiated mental health court, and they are also part of this. This is going to be a fundraiser for both organizations. So if anybody can come out, it's a good time, and actually it funds quite a bit of our activities and the things we're able to do for our people that are in those treatment courts. But if anybody's got any questions, I'm happy to answer them.
Any questions? We have a motion and a second. All in favor say aye.
Aye.
Opposed, same sign. Motion carries.
Thank you, sir.
Thank you. And those who've never attended, that's a pretty good evening. Up next, Mr. Pennewick. Good morning.
Good morning. No report, right?
No report, yeah. I can get a copy of the report.
Good morning, everyone. A couple things. I apologize for missing last month. It was one of those deals where I woke up thinking everything was great, and I had a cup of coffee, and by 6:35, I knew there was no way I was going to make it here, so I apologize for that. My office manager has COVID. We've had a couple people stricken with COVID last week. She is suffering from complications from COVID. The COVID is gone, but she's got some other things that I'm not going to go into. She does the report. Normally she comes in late at night and does them when we're not here. She did not do it this time, so I do not have a report this month. So I had asked for basically my tolerance, and I can get that report on file as soon as she gets back, which should be by the end of the week. So I have no report to discuss this week. I will work on cross-training as far as having someone do it for her next time, but like I said, she's normally very diligent in providing those to everybody, so I have nothing to report beyond that, and if anybody has any questions in general, I'm happy to answer, but other than that, I have nothing to discuss today.
Any questions?
All right, thank you, guys.
Thank you, sir. Up next, probation, Mr. Latham. The packet also is a copy of Tom's monthly report. Take a motion to approve that by Mr. Earps, second by Ms. Turner. Good morning, Tom.
Good morning. I have nothing unless there's any questions on the report.
Questions on Tom's report? We have a motion, a second. All in favor say aye.
Aye.
Opposed, same sign. Motion carries.
I have nothing. I was going to remind you of the auction on the 25th, but John beat me to it. So if you want, I can send that information to Kelly so she can get it out to everyone if that would help with the information. So I'll get it to Kelly today.
Okay.
That's all I had.
Thank you.
All right. Thank you.
Up next, the sheriff, Mr. Downing. In the packet you have a copy of his monthly report. Take a motion to approve that by Mr. Lowry, second by Ms. Monday. Good morning, sir.
Good morning. Good morning, everybody. Couple things to note on the report. As you can see, our revenue is based on our out-of-county inmate population. And if you compare fiscal year 23 through August of 23, for that fiscal year, we were averaging about 368. In 2024, we're averaging about 319. So we're actually averaging down about 49. As we have previously discussed, that has historically been the case around this time for whatever reason, but it is a volatile number that fluctuates up and down. So I don't get too panicked yet, but we are certainly monitoring it. If you recall, a couple years ago, we're still looking at numbers similar to fiscal year 2022 as far as total revenue. And it was, I believe, 2022 when we provided you the report of what benefit the out-of-county inmate program has for the county, and that's upwards of a $2 million benefit to our county. So it's certainly still viable, and we will continue to monitor it as we do. The only other thing before I get into a couple other issues, if you notice our accidents out on our roadways, I don't want to say it out loud, but they're okay right now. So we've been doing well. I think a lot of that is, I know that we do a lot of details, especially around holiday time. The state police, the Illinois State Police, also help us and help the county out with details. They help the city out. They help all the municipalities out with details as well. So I think that is we're reaping some benefits from that as well. So those are good things. And that's really all I got on the report.
Any questions on the report? We have a motion,
Yeah,
a second. All
yeah,
in
I
favor-
do.
Oh, Mr. Hunter, go ahead.
Yeah, thank you very much, Mr. Chairman. Mike, I know that, can you give us a status report on Champaign? Yeah, we're still housing for Champaign. I believe we're averaging around 70 to 75. And we've been told that number's not going to change for a while. Okay. I know that you're active with the Illinois Sheriff's Association and other law enforcement agencies.
would there be a possibility that other entities that jurisdictions may be able to provide inmates to us as well too as in the future? You'd have first dibs on.
It all depends on need. I mean, you know, location is a big issue. Champaign is an hour south of here, 55 minutes if you speed a little bit, but they're an hour away, hour plus, I would say. And it's right down 57, so it's convenient. We have to make some determination as to whether or not our travel is worth the hassle. And again, we also have to have counties have to have a need for that too. So they're and that fluctuates as well. So it's all, you know, it all fluctuates.
Okay, thank you.
Okay, we have a motion and a second on the floor. All in favor say aye. Opposed, same sign. Motion carries. Jail Medical Quality Improvement Program.
Yeah. So I believe that Kelly got that to you guys.
Yeah.
So, and I appreciate that because it was kind of last minute, and Kelly is awesome about getting out things to you when I get them to her at the last minute. So one of the things that we are required to do under our accreditation with the National Commission on Correctional Health Care, or the NCCHC, is to do what they call outcome studies of various things going on with inmate health. And one of the outcome studies that they started, and these, I will bring these to you as we get them. We have a handful of them right now, but I think it's important for you to know that we are not just warehousing inmates who come in here and put them back out on the street without attempting to make them better from a health standpoint. So the outcome study, the first outcome study that I'm bringing to you is we had patients identified who had a BMI over 30. And according to medical people, you can agree with it or disagree with it, your BMI, anything over 30, you're considered obese. And we have had a number of inmates who have come in who had a BMI over 30. And so one of the things that high BMI does, there's a higher risk for those with a high BMI, including cardiovascular disease, diabetes, hypertension, sleep apnea, depression, and a number of other additional conditions. And so our medical department identified a number of patients who, or a number of inmates who had a BMI over 30. And with the goal for between our medical staff and our food provider to bring that BMI down. And most, the goal was 50%, to get half of, and there's a list included in there of, I think there was 15 or so patients who had a BMI over 30. There were more, but they limited the number of what they did. And the outcome was actually 68% that their obesity improved while they were in our custody. And I know that probably doesn't sound all that important to a lot of people. A lot of people don't care, but I've always said that our jail is, and our inmates pose a public health risk, both when they come in and when they leave. And we want the ones who come into our facility to be better health-wise and everything else, knowledge-wise, when they leave. And I just want to credit our medical department for making that happen. And again, I think some people don't want to hear it. They don't think it should happen, but I'm telling you that it makes our community better. And it's a credit to our jail doctor, Dr. Long, all of our medical staff, Elizabeth DeLong, who is our director of nursing. They do a great job. And when inmates come in with these cardiovascular disease, diabetes, it's costly to manage and it's costly to treat. So it's a combination of trying to treat individuals and try and save money at the same time by making them better. So I just thought it was information that this committee should hear when we talk about why we're accredited and what our medical staff does, because the medical staff is a big portion of our budget. And the big portion of our budget actually saves us in the long run when it comes to frivolous lawsuits that inmates file because they don't have any, because they feel like they don't get enough medical treatment. I think you've all heard me say 100 times that the inmates in our jail get treated better medically than anybody in this room. So that's all I have on that, unless there's any questions.
Any questions on that? Medical savings.
Yeah, so you've heard me talk before about Katie, who does our medical billing. And we all know, or we all probably have experienced our medical bills. Obviously, the chairman has, he's got a shoulder in a sling. And one of the things that we have found over the course of time is, and that we really didn't know anything about, was that sometimes that medical billing isn't accurate. And so when we brought Katie in, she had a lot of experience in dealing with medical billing. And so she started this back in May of 2018, and I can tell you that over the course from May of 2018 to present, she has saved us $968,341 in medical bills. That number is astronomical when it comes to money that would have been paid out by the county to various medical facilities. And so credit to her. And again, you know, there is the next thing that she's working on now. So there's an occasion when a detainee requires inpatient treatment. Obviously, that's costly, just the medical cost itself. We also have to, we have 2 officers who may be sitting with that person at the hospital for safety and security reasons. One of the things that she's working on now is getting these inmates Medicaid eligible. And if that happens, then there is absolutely no direct cost to the county. That bill automatically goes to Medicaid. So obviously long-term Medicaid, we're all paying for it. I get that, but locally we are not. So she does a great job with the coding and dealing with Medicaid. And for those of you that are dealing with state agencies like Medicare and all that, sometimes those phone calls can last forever. So she spends a lot of time on the telephone. And I know that there are some people in the medical profession who despise her because she saves us so much money. So credit to her. So $968,341.77.
Wow. All right.
To be exact.
Thank you.
Amazing.
That's it. Well,
Use your mic, please.
well, ironically, so, you know, one of the things that we pride ourselves on at the Sheriff's Office, and we always have, is that we want to be the model for everything involving Sheriff's Office. And we actually just met with a county, and I won't name them for now because I know there's some issues, but we just met with a county who is very interested in our concept of what we do with our medical department and are very interested in what Katie does. So to outsource, yes. And if we can outsource her to benefit the county, we certainly will. So that's really a great question about outsourcing.
Just don't lose her.
No.
Any questions or comments on that? Up next then is the update on the DCFS deputy.
Yeah, if you recall, I don't know, it was probably over a year now, I think I brought to this committee. A few years ago, some of you may remember, there was a DCF agent killed, I believe, in Springfield, killed in the line of duty while going to a home. And the legislature passed a bill that allowed DCFS to contract with local sheriff's offices. I met with them a handful of times, and I got the approval from this committee to move forward with it, because what the DCFS, what that is, they pay for everything, including vehicles, uniforms, computers, deputy, benefits, the whole deal. So there's no money out of the pockets of our budget. And then all of a sudden, DCFS went silent. And so I just thought they weren't interested anymore. And about 6 months later, I got an email from a guy who had replaced the person who I was dealing with, and said, we know you talked to so-and-so, but she's no longer with us, or in a different position, or wherever she went to, and we really want to move this forward. So we started to, we have a sample MOU, or intergovernmental agreement. We also have a list of money that would require for us to start up, that we are going to submit to DCFS for approval. And then we will hopefully move forward with this if it's still the board's pleasure.
That's not like it. Can we do a motion on that? It's on the agenda. Mr. Coughlin? I didn't hear what he said.
Yeah.
Yes.
He said
Okay. I take a motion, and Mr. Long, second by Mr. Lowry. All in favor, say aye.
Aye.
Opposed, same sign. Motion carries. What else, sir?
I got one other thing to talk about, and it's we are coming up to our 1 year. I don't want to call it an anniversary, but our 1 year since the Pretrial Fairness Act went into effect on September 18th of 2023, the elimination of cash bail. Obviously, I haven't been a big fan, and next month we will have some statistics for the entire year, 9/18 of 23 to 9/18 of 24, involving the entire Safety Act and Pretrial Fairness Act. But I just wanted to touch on one thing right now that we predicted, and nobody listened, but that's par for the course with some. I've always said that body-worn cameras, the additional training, and the decertification were good parts of the Safety Act in their own way. You talk to a police officer across the county, probably across the state, and they love body-worn cameras. We loved them so much we put them in our jail as well, and our correctional officers love them. So that's certainly a positive, and something that we need to continue to get better, move forward. I don't think any police agency around can tell you that they're perfect. There's some things said on those body cameras that may be inappropriate, but in the heat of the moment, sometimes those things get said. But nonetheless, regardless of what is said, the actions speak for themselves, and I'm proud of both our corrections division and our deputies who are out there every day in the heat of the moment sometimes, and the actions that they take and what they do. So that is a good thing. The one thing that we talked about that we knew was going to be a problem was the failure to appear and show up to court. And with minimal incentive really to show up to court. On September 18th of 2023, Kankakee County had 5,402 active warrants. from September 18th of 2023 through September 6th, which would have been last Friday, there were 1,282 warrants issued since 9/18 of 23. Of those warrants, 611 of those warrants alone were served, either by our deputies, by other police agencies. Sometimes they were out of county, sometimes they were out of state. Of these 1,282 warrants since 9/18 of 23, 482 are still outstanding. Approximately 189 of those 1,282 warrants either have been quashed by the court, somebody may have turned themselves in, or so on. So the numbers technically add up, but there's 189 of them that are not accounted for as far as whether they were served, whether they were not served. Because, like I said, sometimes they quash the warrant, which means they got rid of it. As I mentioned earlier, on 9/18 of 23, there were 5,402 outstanding warrants. As of September 6th, which was last Friday, not quite a year, there are now 5,850 outstanding warrants. This is something that we warned legislators about, and this will only get worse. Cash bond at one point was an assurance to show up to court. And if you didn't show, you could have your bond revoked. We don't have that anymore. So there's no skin in the game, as they say. And when you got picked up on a warrant, if there was a bond on it and you couldn't pay the bond, you had to stay in jail because you didn't have to show up to court. It's a very easy concept. Show up to court. I mean, people complain about Warrant Wednesday because their buddy got put on Warrant Wednesday or their spouse got put on Warrant Wednesday. Here's the solution. Show up to court and you won't get put on Warrant Wednesday. It's as simple as that. It's a very simple concept. Most, and I would say about 90% of the warrants served are for non-detainable offenses, which means our police officers utilize resources to go arrest somebody. They may sit in jail for maybe 24 hours, and then when they appear in front of a judge, they get released because they can't be held because of the Safety Act. So at what cost are we going to continue to arrest these individuals knowing that they're going to get out and there is literally no accountability whatsoever? And it frustrates the hell out of me and every police officer in the state of Illinois. Because, as I've said before, and you've heard me say this before, serving a warrant is one of the most dangerous things police officers do. The majority of shootouts with the police involve serving a warrant. And when there are shootouts with police, that never ends well. In addition to that, if somebody gets picked up out of county, we utilize resources to go get that person because now we have to go get them within 5 days. So regardless of what our staffing level is, regardless of if we have personnel, we are required, if we want them individuals back here, to answer for their own lack of responsibility, not showing up to court, and utilize our resources to go pick them up for them to get released the next day. Obviously, the more serious warrants, obviously those are more likely to stay. But as I said, 90% of the warrants that we're dealing with are non-detainable offenses. It's a waste of manpower, it's a waste of resources.
And it's a waste of money.
And it's a waste of money. If they are too far away, for instance, let's say they're out of state. I know we've dealt with pickups in Memphis, we've dealt with pickups in Arizona, we've dealt with pickups in Florida. it is not economical for us to send 2 deputies or 2 correctional officers to go get these individuals, so we hire an extradition company that we pay money for. So we're paying one way or the other. So, this is something that obviously we knew of before it went into effect. And it was like talking to the wall, knowing that these warrants are going to continue, these warrants are going to increase. And as I said, the frustration level amongst law enforcement is, it's almost, you have to ask the question, why? Why are we wasting taxpayers' money? Because, as I said, with no cash bail, and you can say that, cash bail is, it affects the poor people, and in some cases it does, but as I've told this committee, we were one of very few counties who said the Safety Act won't affect our jail population, because we have the people who are in jail, who need to be in jail, and the ones who shouldn't be in jail, we are working with the state's attorney to get out of jail. So, I sit up here not because I want to tell you that we were right about something. I sit up here to tell you that that's what's going on, and that's what's that is going to affect longer term, our budget and our resources and the county's finances. So that's all I got.
Questions?
Yeah, Chairman, I have one question. Sheriff, and I meant to ask Sandy about this, because maybe she'll have the information. Since the implementation of the Safety Act, can you give us a trend in terms of revenue loss at all, or would Sandy have that?
That would probably be Sandy and her office.
Okay.
She's getting up
She's
there.
getting up. Hang on.
I meant to ask her that, and I just wonder if you share that information.
I don't
She
have,
shares that with you.
I don't have anything specific right now. I can get that for the next meeting if you want me to run that report.
Yeah.
But it's obvious just by any of our collections that it's just, everything is just low. I mean,
Yeah, down. Yeah, I know. And I just wonder if there, can you give us a trend on that?
Sure.
But if you have the specific numbers, that's fine too, and I appreciate that.
Sure, we'll do.
Thank you. Thank you.
Mr. Hunter, there's no incentive to show up. There's no incentive to pay off your fines. And as
Oh,
I've said
I hear you.
before,
I hear you.
the Safety
Yeah.
Act it will strictly force law-abiding, tax-paying citizens to foot the bill for all the criminal activity in not only Kankakee County, but statewide.
There's a disincentive, for the guys to arrest the bad folks, because they're going to be released. I understand what you're saying. Adverse impact.
That's all I got.
This also reflects on your report, though, where the entries into the courthouse.
Yes. Yes.
That they're down a lot.
Yeah.
So,
Yeah. You don't have to show up to court.
any other questions, Ms. Herbst?
I just have to say that I agree with you. As a small business owner, I totally agree with you. What happened with us over the last month,
Yeah.
unfair, and we've got the bill on it. So totally agree with you.
And even if they find those guys,
They just give them a ticket,
it's non-detainable.
right? Even though they were carrying guns in our dealership.
Yes.
Yeah.
Welcome to Illinois.
Okay. Thank you,
All
sir.
right.
Carrie, do you have anything good for us? Okay. Up next, Animal Control. Ms. Laird, you have a copy of her monthly report. Take a motion to approve that by Mr. Lowry, second by Mr. Long. Comments on the report, Gary?
You'll see animals adopted. That's between transfers and adoptions. There was 70 that left, which was great. Between Anti-Cruelty, It's a Pity, River Valley Humane Foundation, and Forever Loved, Kelly, the shelter manager, was able to get all those animals pushed out to rescue. We did have 14 adopted, which was great. We're getting a lot more foot traffic at our building, which was nice. Plus, we were able to cut our adoptions in half due to a fundraiser we had with the realtors. So that was very beneficial to us and to the animals in our facility. So it was nice to see all those animals leave either with, with rescues or with new homes. So it's working out well, and credit to the staff too for making those animals adoptable. That's all I have for the report.
Any questions or comments on the report? We have a motion and a second. All in favor say aye.
Aye.
Opposed, same sign. Motion carries.
Two things. This Saturday, I'll be in Shabance for the Shabance Homecoming. We are doing a little bit of an adoption fair. I'm going to bring a dog or two down there for that. They asked us, since we were contracted with them, just to be a good event to have, show face out there and bring an adoptable pet or two. And then we'll be at the farmer's market on the 28th for another microchip clinic.
Good.
Okay. Thank you.
Okay, thanks. Up next, Coroner's Office, Mr. Gessner. In the package, you have a copy of the monthly report and the monthly receipts of money. Take a motion to combine and approve them. Mr. Long, Ms. Ripnick, a second. Good morning, sir.
Good morning to you and to everybody. Excuse me. I have nothing but good news to tell you that all our numbers are down quite considerably. As you can look at it, July and August, still getting a lot of calls in the office on natural deaths and stuff like that, but we're down considerably. You can see the autopsies are usually it was average between 9 to 11 autopsies. We're the last two are 3 in July and 1 so far in August. And even our outside autopsies too, coming from Iroquois, there you can see they've only had 4 in the whole year. So, which everybody seems to be down. That's basically on my report. I know that if you have any questions on that, it's pretty well easily defined.
Any questions on the reports? We have a motion and a second. All in favor say aye.
Aye.
Opposed, same sign. Motion carries. What else, sir?
I think the only thing I'm going to report on is the overdoses are holding. We're still just at 15 for the last 2 months, basically. I owe a lot of that to my staff, getting out to the public, talking about different drugs there and what it can do to you. We're working right now on vaping. There's a lot of things going on in the vaping right now, and I'm worried about the young kids that vape because the amount of THC in some of the vaping is up to almost sometimes 65 to 95%. That's high. So we're working on that. Other than that, we're still out and about in the county with our hidden in plain sight trailer. It's what's been really good. Going out there, if you happen to see it, we're out. I think about at least 10 to 11 times more in the county here. So that's really amazing to see where kids can hide drugs. So it's been very positive. So other than that, that's it. I don't have any questions.
Questions? Sorry, we can't take questions from the gallery.
That's it?
That's it.
All right. Everybody have a good good day.
Up next, Tyler Technology Update. Mr. Shane, Jason.
Good morning, everybody. I just wanted to make sure that I'm here for any questions you guys have on the report. As you heard from the Chief Judge and Sandy, everything is going well. We go live in less than 2 weeks now. So far, everyone's put tons of great work into the project, addressing any issues that's came up, and everything looks good so far. Anything else?
Any questions? Where would we be without you guys?
I gotta give credit to the different departments. I mean, they've been working long, hard hours, making sure everything's going into it, and they're the ones that's lifting all the heavy weight.
Any questions for Jason? As I said before, everybody understands this new system, correct?
Yep. Yeah, they've been going through, as the Chief Judge said, the judges are going through training this week. This is our 3rd week of training. Next week we're doing all the button up, and then we go live.
Great.
Thank you.
Yes. Is there any old business come before the committee? Well, we have to give
You.
Jason a minute to get back upstairs.
Oh, sorry, okay.
Any other old business? Any new business? Any new business? Miss Monday?
Now, motion.
Okay. Mr. Carrico? Got motion to adjourn. All in favor, say aye.
Aye.
Opposed, same sign. Motion